Okay, so now we're gonna do some cranial nerve testing. I'm gonna start with cranial nerve 2, which is the optic nerve. So we're gonna start with cranial nerve 2. Cranial nerve 2 assesses vision in the 4 different quadrants, okay? So I'm gonna ask the patient to focus on a spot on the wall behind me and go ahead and close one eye for me. Perfect, okay. So with my hand, I'm gonna come from behind, wiggle my fingers, and you let me know by saying yes when you see my fingers. Good.
Yes.
Perfect. Other side.
Yes.
Good.
Yes.
Okay, now we'll cover the other eye. Again.
Yes. Yes.
Perfect.
Yes.
Okay.
Yes.
Perfect. Okay, that's cranial nerve 2 for vision. Next, we're going to test cranial nerves 2 and 3. This is the pupillary response. So I'll ask the patient again to focus on a point behind me, and I'm first going to observe her pupils for symmetry, diameter, which look normal. Then go ahead and place a bridge between your nose or on your nose. And I'm going to come in with a light. I'm going to assess pupillary response on the ipsilateral eye, which would be this eye, her left eye. Perfect. Good, that's normal. I'm going to do it again. That's a direct response. And then I'm going to do it once more to test the contralateral eye, looking at pupillary response on the right eye. Okay, so next I'm going to do it on the opposite side, testing direct response, and then testing consensual reflex. Good. Okay. Same thing, we're going to test for accommodation. So, like the pupillary light response or reflex, with items coming closer to the eyes, there is a pupillary response that's normal. Come in here. Good. That's normal for cranial nerves 2 and 3. So lastly, we're going to test cranial nerves 3, 4, and 6. That's the ocular motor nerve, trochlear nerve, and the abducens nerve. So for this test, I will ask the patient to focus on a point behind me, okay? I'm assessing for any abnormalities, and I'm going to ask the patient to follow my pen, okay, in a vertical path, or a horizontal path first. Good. Keeping the head still. Good. Now we're going to go vertical path. Perfect. Good. Good. And that's cranial nerve 3, 4, and 6 for extraocular eye movements. Perfect. Okay.
So we're going to be assessing cranial nerve 2, the optic nerve. And to do that, we're going to have him focus on a spot on the wall, cover one eye. And then I'm going to be testing the eye that's not covered. I'm going to be moving my hand into the different quadrants of his visual field. And just respond with yes if you see my hand. Okay, when you see it. Ready?
Yes. 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 Yes.
And the other eye. And still focusing on that spot.
Yes. 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 Yes.
Okay, so that would be a negative test. A positive test would be if he had vision loss or if he wasn't able to see my hand in his visual field.
Today we're going to be doing some coordination testing. We're going to be testing for dysmetria and dystatokinesia. To begin, we're going to get started with finger to nose test for dysmetria. Ensure that you are close to your patient and able to guard them just in case they sway to one side too much or if they are a fall risk. First, ask for consent. Am I able to extend your arm upwards for you? Yes? Okay. From here, instruct your patient to tap their fingers on their nose and return to the same starting position 5 times. When you are ready, begin. And 5. Awesome. Okay. For the next test, it's called the heel to shin test. So instruct your patient to place their heel on their ankle. From here, you're going to move the heel up and back down, ensuring that you keep the heel on the shin. Okay? And when you are ready, begin. And 5. Okay? So the purpose of these tests is to assess for any abnormalities that they might have. For example, if they're not able to return to the starting position or move through the range of the movement smoothly. For the next test, we're going to be testing for dystatokinesia. We're going to be performing rapid alternating movements of the forearms. So you're going to place your arms on your thighs from here. You're going to go like so and back as fast as you can 5 times. And begin. 1, 2, 3, 4. Good. Well, that was 5. For the next test, we're going to be doing the toe tap test. You're going to maintain the heels on the ground and tap the ground 5 times as fast as you can. Okay? And when you are ready, begin. Awesome. So this test, this dystatokinesia, is testing for the rhythm of the movement, making sure that chi is in sync or that your patient's in sync on both sides. Take note of any tremors or dysmetria that might be going on. Thank you.